Muscular imbalance in your back mean a lot more than you realize, and I have a proposal for you. Stay tuned. Hey, this is Dr. Shakib from Irvine Spine and Wellness Center, your Irvine Posture Movement and Chiropractic Clinic. One thing I find quite often in my practice is the actual imbalance of the muscles on both sides of the spine. So when I'm looking at the patient's back and I'm having them hinge forward and I lift the shirt up, when I'm looking at things tangentially, meaning this way, I can see that one side paraspinals, the muscles on the sides of the spine, is actually higher than the opposite side. There is an actual atrophy. Most people think atrophy means, a nerve was severed, and not necessarily. That is a telltale sign that this individual has been moving around, but has been moving around dysfunctionally to a point where one group of muscles on one side is not behaving like the other side. So what ends up happening typically when it's in the lower portion of the spine, when there's an atrophy, let's say in the lower portion of the left side, typically that individual is going to have issues with mobility of the opposite side shoulder. So you may be going in complaining of right shoulder, but the problem comes from the lower back on the left side because there is an actual atrophy or misuse or not use of those muscles properly. Just wanted to bring that to your attention because that is totally getting skipped in a lot of cases. So maybe next time you can just with practice, you can master it yourself. Start paying attention to those things. Maybe check your friend at the gym, or your friend can check your back and see if you find that discrepancy, and shoot me an email. Let me know what you find. Hope this helped.